Do you frequently feel like your heart aches sometimes? Or maybe you get really tired after just walking a short distance. Imagine your body is like a city, and your blood is the delivery truck bringing oxygen to every home. In sickle cell disease, those delivery trucks, red blood cells, are broken. Instead of being round and flexible, they become stiff and shaped like a sickle, a curved knife. This makes it hard for them to move through small roads, blood vessels. So the deliveries get stuck, and parts of your body don't get the oxygen they need. That's why people with this disease often feel pain, get tired quickly, or get sick more easily. Does that sound familiar to you or someone you know? So what causes these broken delivery trucks? It's not from eating bad food or not exercising. It's in your genes, like the color of your eyes or how tall you grow. When a child gets a special version of the hemoglobin gene from both parents, one from mom, one from dad, they get sickle cell disease. Think of genes like instruction books. In this case, the book has a typo. Instead of saying make round red blood cells, it says make sickle-shaped ones. You can't catch this disease like a cold. No handshake or hug passes it. But if both your parents carry that typo, you might inherit the full disease. Do you know if anyone in your family has this? Now, what does it actually feel like to have sickle cell disease? Picture this. One day you're playing soccer with friends, and suddenly your chest starts hurting, or your fingers swell up like balloons. That's a sickle cell crisis, when the sickle cells block blood flow. Some people feel sharp pain in their back, chest, or stomach. Others get very pale and dizzy because the body isn't making enough healthy red blood cells. This is called anemia. Often, kids with this disease grow slower or get more infections. Have you ever felt pain come out of nowhere and last for hours or days? That's one of the big clues doctors look for. How do doctors know if someone has sickle cell disease? Babies in many countries get a simple heel prick test right after birth, like checking if the instruction book has that typo we talked about. Blood tests show the shape of red blood cells and what kind of hemoglobin is in them. If someone is diagnosed, treatment isn't a quick fix, but it helps a lot. People drink lots of water, take vitamins like folic acid, and sometimes get blood transfusions to add healthy red cells. For pain, doctors give medicine. And in serious cases, a bone marrow transplant can even cure it, but only if there's a matching donor. Do you know someone who gets regular checkups or blood tests for health reasons? Can we stop this disease before it starts? Yes, but only through smart choices and planning. Since it's passed in genes, couples who are planning a family can get tested to see if they carry the sickle cell trait. If both do, there's a 25% chance their child will have the disease. Genetic counseling helps them understand their choices. Also, in countries with newborn screening, doctors start treatment early, sometimes even giving babies antibiotics to avoid infections. So prevention isn't about one thing, but about testing, knowledge, and care before and after birth. Have you or someone you know ever got tested for genetic conditions? Exciting news, you won't believe this. Scientists are now using a new gene editing tool called CRISPR, kind of like a molecular pencil that can fix the typo in the instruction book. In recent years, some patients have been cured after their own stem cells were edited and put back into their body. One woman, Victoria Gray, was the first in the US to get this treatment, and she hasn't had a pain crisis since. Also, new drugs like crizanlizumab help reduce pain crises by keeping blood cells from sticking together. These advances don't work for everyone yet, but they're big steps. Imagine a future where a single shot can fix the gene, and you never get pain again. Isn't that amazing?